And at that time, we were concerned about the impact of the fact that there are still people who are unvaccinated. And as we are starting to see multiple variants of the virus started to spread around the world, the latest of these being the Delta variant. And the Delta variant has proven to be much more effective than the other variants that we have dealt with before. And it has spread fast around the globe and now around the nation, where we are seeing state after state having record numbers of infected people. And it has mostly affected people who are unvaccinated. Despite the fact that we are seeing breakthrough infections for people who are vaccinated, the reality is that the majority of people who are admitted to the hospital and who are sick at the present time are people who are unvaccinated. And because of the Delta variant, and because of the fact that there are a number of people who have not been vaccinated, we are seeing the number of people who are testing positive go up day after day. On July 21st, so this is just a few weeks ago, our positivity rate was 3.6%. Today, it is 9.4%. It has been hovering around 10 to 11% for the past few days now. So triple in the number of the positivity rate among people who are testing. We have also seen an increase in the number of people who are admitted to the hospital with COVID. As of this morning, we had 88 adult patients hospitalized with COVID across our whole system. In addition to these 88 patients, we have another 15 or 16 patients who are suspected to have COVID and we are waiting for their testing. These patients that we have in our hospitals are distributed among all our hospitals. We have 25 patients at Henry Ford Hospitals, 24 at Henry Ford Macomb Hospital, 14 at Henry Ford Allegiance Hospital in Jackson, 13 at Henry Ford West Bloomfield Hospital, and 11 at Henry Ford Wyandotte Hospital. We also have one COVID patient at our psychiatric hospital at Kingswood. For those who remain reluctant or hesitant to be vaccinated, we really urge you to seek information, talk to your provider, and get the facts regarding the vaccine. These are important decisions to make for yourself, for your loved one around you, and for those you care for. What I would like also to share that in the past few weeks, we have seen some glimmer of hope and some good signs that there are more and more people coming forward to get vaccinated. In fact, we have been averaging about 1,500 doses of vaccines per week over the past 4 weeks. And when we look at our healthcare workers and our workforce within our healthcare system, we have exceeded an 85% vaccination rate since the beginning of July. So we've seen a significant increase and adoption of the vaccination message that we have shared with our staff. And we are thankful to them, and we are thankful to the fact that they are working hard to take care of patients, to protect themselves, to protect their co-workers, and to protect their family. When the FDA the FDA is expected to give the final approval for the Pfizer vaccine in the next few weeks. We anticipate at that time that this will trigger a domino effect with more people advancing to get vaccinated. And we'll likely have more organizations and businesses requiring vaccination for their employment. And a final point, I just wanted to talk about the booster shots. As you have heard in the past few days, the CDC has recommended that immunocompromised people are eligible for a third shot. And this is based on a data that shows that as the duration of the vaccine gets longer, and as the date when we get the vaccine gets further away, our immunity and defense system to the vaccine goes down, especially among those who are immunocompromised. And accordingly, the FDA and CDC, the CDC has recommended that people who are immunocompromised get a third shot, which we strongly endorse. And our team and Dr. Cunningham will be sharing with you some of the steps that we are taking, but we definitely are working internally to make sure that we make the third shot of vaccines available to our patients who are eligible for these. Also, you might have heard today that US health officials and medical experts announced that booster doses of COVID-19 vaccines will be also offered to everyone starting in the fall. Again, with the idea that those who got vaccinated in December and January might have a waning immune defense against the COVID, and that a booster shot will help with that. Need to be clear that the vaccine continues to be very effective against the Delta virus. And despite the waning immune effectiveness after a certain period of time, the vaccine is still very protective. So this is not to say by needing to get a third booster or third shot that the vaccine is not effective. It's just saying that we need to get another booster so that we can build the immune system to defend against Delta virus and other viruses. So for those who are not vaccinated yet, our plea to you, please get vaccinated. And for those who are vaccinated and those who are not, please let's make sure that we follow all the protective measures that we have followed earlier in the pandemic so that we protect ourselves, we protect our community, and we put a stop to that spread of the Delta variant. This includes wearing masks in indoor public settings, when we are out grocery shopping or to a hardware store, and definitely in schools. And vaccinations are masks are the best tools for us to move us forward. And we are confident that once we get more people vaccinated, we'll be able to get back to some normalcy. I would like to turn it over to Dr. Cunningham.
Thank you, sir. Good afternoon, everybody. Picking up on Dr. Moncara's thread about the booster doses, we have heard about them for a while now. We've had a lot more information from CDC and the FDA over the past couple days, and here's the latest information I have for you. Last Friday, the CDC announced that they formally recommended a booster dose of COVID vaccine for people who have moderate to severely compromised immune systems. And the studies really showed that people with this degree of immunosuppression, where their white blood cells don't fight infections off quite as well, they don't always get great immunity with 2 doses of the vaccine. But when you give a third dose of vaccine, these antibodies start appearing, these protective proteins, and it made a huge difference for immunocompromised people. We do know that out of the breakthrough cases of people who wind up in the hospital, at least half of them are people who have weakened immune systems. So this is another reason why it's so important to vaccinate this group of people. We're also seeing breakthrough disease in the very frail elderly, but we are not seeing healthy people who receive the vaccine hospitalized, which again shows you how effective these vaccines are. At this time, the booster dose is only for people who received either the Pfizer or Moderna vaccines. There's not yet enough data to know what to do with those who received the J&J vaccine. There are studies looking to see if that needs a booster as well, but that's probably going to come out in the next few weeks. You should get a third booster dose the same as the first 2 you had. So if you had 2 Pfizer doses, get a Pfizer booster. If you had 2 Moderna doses, get a Moderna booster. Those boosters, again, are for immunocompromised people, and doses should be given at least 28 days after the second dose. This morning, the federal government announced that sometime in September, booster shots will be available for everybody 18 years of age and older. The booster would be given 8 months after you completed your second dose. The government said the data showed that immunity does decrease over time. There's still no decision yet on boosters for J&J. That will be coming out. So what should people do right now? Our advice is as follows. If your immune system is moderately to severely compromised due to your medical conditions, get the booster now. It's readily available at pharmacies and grocery stores, including some municipalities such as the city of Detroit. Detroit is giving boosters at the TCF Center. You don't even have to provide documentation of your condition. Just call the city to schedule your appointment at 313-230-0505. Henry Ford agrees these booster doses are a great idea for immunocompromised people. We are 100% behind this because the science is strong. We are working on our own plan to implement booster doses in an easy, convenient way for our patients. We're finalizing these plans and we'll have them out shortly. One question I've heard is whether there's any potential harm or risk for these immunocompromised people getting a booster. And it turns out the booster was safe, effective, very well tolerated. The safety profile was very good. The same side effects were seen as with the first 2 doses. Again, the FDA and CDC have not mentioned any guidance on booster doses for people other than those with immunocompromised. We are aware that there are news reports the federal government will be recommending booster doses for most people 8 months after they finish their vaccination. We learned one thing in this pandemic. We need to be a little bit patient because the science about the vaccines and this virus continue to evolve. We will be prepared to administer booster doses to any of our patients and employees once we get the green light from the FDA and CDC. And with that, I'd like to turn it back over to Dr. Mankara.
Thank you, Dennis. Dr. Cunningham and I are happy to take your questions now.
All right, folks. Okay, Sarah Sweck, I see your hand going up right away, so we'll go ahead and give you the first question. Go ahead, open your mic and let us know which outlet you're with, please. Then I have Chris Hall, then Kim Russell.
Hi, thank you. I'm with Michigan Radio. So I'm wondering if we could get a breakdown of the current hospitalized population at Henry Ford in terms of how many are vaccinated and how many are unvaccinated?
About 80% of our people who are hospitalized are unvaccinated, and 15 to 20% are vaccinated. That definitely varies between day by day, but at least 80% on any specific day of the people who are hospitalized are unvaccinated.
Okay, and you mentioned, sorry, quick follow-up. You mentioned that, or Dr. Cunningham mentioned, I think, that the people you are seeing who are vaccinated tend to be immunocompromised or have some other sort of medical condition. Is that correct?
That's correct. They tend to have either a very weak immune system or they are very elderly, the frail elderly.
Okay, thank you.
Thanks, Sarah. Okay, Chris Hall, I have you next on my list. Go right ahead. Then it'll be Kim Russell, then Deanna.
Yeah, hi, Chris Hall at the Detroit Free Press. A couple of quick questions. In terms of those vaccinated who are hospitalized, do we know of the 15 to 20%? Do we know what percentage of that percent is pretty much frail or immune compromised, or would you say everybody in the 15 to 20% falls into that category?
It's about half of them are immunocompromised, the other half frail elderly. It varies a little bit day to day, but that's how the numbers have been trending.
Okay, great. And a follow-up question too, which I haven't really seen much of this, and maybe it's just an assumption because it's the same. What are you hearing in terms of the immunocompromised booster? Is it the exact same dosage as dose 1 and 2 for dose 3 for immunocompromised? And I know that they're talking about boosters in the future, if that's approved by FDA and ACIP. Will that also be the same dosage, or do we know if that dosage could be different for the rest of the population? Have you heard anything on those details?
So for immunocompromised patients, they are getting the same exact vaccine, same exact dose. There's no changes there. There are trials right now that are looking at booster doses that have been varied a little bit for better protection against newer variants. Those are not yet approved. So if we do start giving booster doses to the general population in September, I expect they too will get the same dose, same vaccine.
Okay, and do you know, a final question, when your boosters for immunocompromised, when those details will be coming? Is that something today, tomorrow, for patients who are interested in that at Henry Ford?
So we have started to put some information on our website. This week, we will finalize the details of how patients can schedule their appointment to get vaccine doses. But again, if it's easier for them to go somewhere else, we just say, get the vaccine because we want you protected.
Thank you.
And Chris, just to add to what Dr. Cunningham has said, we have finalized the groups that will qualify for immunocompromised. So this is available now on our website, and for all our providers and our including our nurses are aware the patients who will need a booster. The logistic of when we are, how to kind of schedule it, we are working on it, as Dr. Cunningham mentioned, the next couple of days.
Okay, thank you. And will some of these boosters be available either at hospital clinics or through physicians' offices as well?
So we will initially be offering it through our vaccine clinics that we have.
Okay, thank you.
Okay, Kimberly Russell, you're up.
Tomorrow, lawmakers are scheduled to debate legislation that would ban employers, including hospitals, from requiring masks for unvaccinated employees, and also would ban any discrimination against the unvaccinated, such as requiring vaccinations in the workplace. What are the potential impacts as a hospital system that you want people to know about?
Our overwhelming concern is we want to have a safe place for our patients to receive care. We want our employees to be safe as well. And if we have surges similar to the past, it's so important we have all our team members able to be here working and healthy. We take our commitment to our communities, to our patients that we serve very seriously, and we want to be here for them. I don't comment on the politics of what people are doing. I'm just going to follow the science and say we are going to continue to wear masks as directed by the Michigan Occupational Safety and Health Administration and recommended by the CDC, because there is so much COVID community transmission right now.
And we're also talking about masks in schools a lot, and with the Delta variant spreading much more easily. Are there concerns that we could see a spike in pediatric inpatients? And are there any concerns about capacity?
Dr. Munkara, why don't you go ahead and add to the first question, and then we'll take your second question, Kimberly. Thank you.
So the first question, to your point, Kimberly, is the decision to mask people within the hospital has nothing. We've used it before for the flu. So in the past, when people did not have flu vaccination, we've asked people to kind of wear masks. And at the present time, it's a safety issue. And it is unfortunate that we are mixing safety and science with politics at the present time. I mean, what is the next thing? Is the legislator is going to decide which medication we can give or we cannot give based on the science that exists out there? It is really concerning to me with where we are having with that dialogue and the discussion. Wearing a mask is a medical decision within our hospitals at the present time that is supported by data that is national, international, that is on science, not only within the United States, but around the nation. And with respect to your question about the masking in the schools or what we are seeing, of course we are concerned. We are already seeing children who are having testing positive. We are seeing that there are hospitals around the nation that are filling up with pediatric patients because of COVID. So COVID is not sparing children at the present time. And our team, led by Dr. Cunningham and many of our experts, are at the present time looking very closely to how the numbers are going to turning around with respect to children, because we might get into a situation where our children's hospital will be overwhelmed, and we don't want to be there.
Thank you, Dr. Munkara. I really appreciate that answer and your leadership on that one. Mike Wilkinson, I saw your hand go up after we resolved your first question. Did you have another? You're next on my list.
I do.
Go ahead.
Yeah, I'm sure as doctors, you are always encouraging people and have been to get the vaccine and counseling them on the facts. I wondered, with Delta triggering an increase in infections and hospitalizations among the vaccinated, even though it's still a lower number, has that, and along with the call now for boosters, not just for the immunocompromised, but for everybody, has that complicated the messaging around the effectiveness of the vaccine for you? Has it made your job a little bit more difficult to encourage them?
I don't think so. These vaccines are very, very good. Even though there's breakthrough disease in healthy people, it's very mild. People aren't coming to the emergency department. They're not coming and being admitted to the hospital. They're not dying. So I think the message is the same. This will keep you out of serious health problems. And again, the breakthrough disease, when we look at our own employee data, very, very small percentage of employees are having symptoms with breakthrough. It's really more of a problem in those who have a weak immune system or the frail elderly. I still remain convinced that these vaccines are excellent, and I'm very grateful that I received my doses, as did my family.
Thank you.
Thank you, Dennis, and thank you, Mike, for that question. Our next question is from Deanna, who typically can't open her microphone. So Deanna, I'm going to ask your question for you. Deanna Lights from WWJ is asking, what do you recommend schools do regarding COVID testing for students and staff? And how do schools prevent students from going to school if they are sick with COVID?
So in terms of testing people, we have to remember there's a limited number of tests at any one time. Right now, our capacity is great, but if every school starts testing every student every week, we could certainly have shortages there. I think the most effective approach is prevention, which is telling people if you're sick, stay home. Consider the masking mandates. I do think that's a good idea. I agree with the American Academy of Pediatrics. Masks are important, especially for kids under 12 who aren't eligible for the vaccine. Testing, I'm just not on board with because I could see that really straining our healthcare systems when we're already quite busy.
Thank you, Dennis. Okay, my next question is from Alex. I'm going to say Alex B because I don't want to butcher your last name. If you could go ahead and open your mic and let us know which outlet you're with, please, Alex.
It's Alex Bozarjian. I'm with Channel 7.
Thank you. Go ahead.
So my question is, with the Delta variant accounting for a majority of cases in Michigan, with people who are, in the hospital, are you seeing them sicker with more complications? I know there's some preliminary data that suggests that the infection could be stronger, it could be worse. So what are you seeing in terms of people who are entering the hospital, with COVID, with the Delta variant being, most prominent in the state?
Patients are doing better. And I think a lot of that, though, is our experience. We've gotten better at knowing how to treat it, how to prevent patients from getting to the point where we need a breathing tube and a ventilator. But they're still coming in quite sick. Again, the people who come into the hospital, a lot of times it's respiratory failure, they're having trouble breathing, and they can have other organ involvement as well. So I don't really think there's been a huge shift in the patients that we're seeing. They're still sick.
A couple of things I would add to that. One, our percentage of people who are needing to be in intensive care unit continues to be hovering around 25%. So 1/4 of these people are needing to intensive care in our hospitals. Now, to the point Dr. Cunningham has brought up, we have learned that the more we delay putting any of these people on a breathing machine, on a ventilator, the better off we are. And this is we've learned early in the process of treating COVID. I would also add to what Dr. Cunningham has mentioned is that the majority of people at the present time who are testing positive are under age 50 because of the fact that we have a much higher vaccination rate in the elderly. So accordingly, as Dr. Cunningham has mentioned, we have people who have comorbidities, but we also have younger patients who are admitted to the hospital. And, we are seeing, that they are not sicker than they were before, but the people who are in the hospital are sick enough to be in the hospital. And as I said, necessitating intensive care support. So this is another reason that we need to kind of be stepping back and say what we are trying to achieve here. And the reality is that the vaccine are effective for the young and the elderly. And the fact that now that we've vaccinated a significant proportion of the elderly, we are seeing the positive and the protective effect of the vaccine. And it is time now for the younger population who have felt in the past that they are protected. Not really, because we are seeing them getting sick and being in the hospital. And this is where them coming forward to get the vaccine is important.
And just piggybacking off of, getting more people vaccinated and making sure they have the facts. When these young people, or really anyone gets to that point that they're in the hospital and they haven't been vaccinated, are you seeing changes of heart? Are you seeing people, maybe look at protecting themselves with vaccines differently?
I don't know because I am not seeing them in the ICU or the adults in the hospital. Primarily, I'm focused just on our COVID precautions right now.
And I would imagine that's the same situation for Dr. Munkara. Thank you so much. Folks, okay, that's everybody on my list. If anybody else has a question, go ahead and put it in the chat for me. In the meantime, I'm going to take the opportunity, a point of clarification. Dr. Munkara, you said 15 to 16 suspected cases of COVID, correct? 15 to 16? Okay.
Yes, in addition to the 88 that we have confirmed that are in our hospitals, we have another 15 to 16 at the present time because it fluctuates depending on the time of the day that we've looked at the data that are. So we are just over 100 patients with either confirmed or suspected COVID within our hospitals.
Okay, thank you very much. I'm not seeing any other questions, so I'm going to wrap things up, folks. I do want to let you know that we will be hosting a Facebook Live with 2 of our doctors who are part of our long COVID team. That's going to be tomorrow at 2 p.m. That's Thursday at 2 p.m. Very informative. If you have a moment to listen in, I recommend it. These efforts are incredibly important and interesting. I think you'll learn a lot, and this is going to be a big part of our COVID story going forward, the long COVID. And with that, not seeing any other questions, I'll turn it back over to Dr. Munkar to just wrap things up for us, please.
Thank you, Dana. We appreciate you being with us and asking us, sometimes the tough questions. And we hope to continue to be with you, sharing the information, sharing the data as it becomes available to us. As you've heard from Dr. Cunningham and myself today, what we are trying to do is keep you abreast of what is happening, what we are hearing, basing it on data, and how we are helping implement it for the community. And again, my plea to everyone who has been reluctant or hesitant to get the vaccine, please seek your information from trusted sources. This is our ask to you.
Thank you. Dennis, anything to add?
Please get vaccinated, consider it carefully. As much as we like people, I'd rather see you outside than be admitted to the hospital.
Thank you, Dennis. And thanks everybody for joining us. Have a great afternoon, and we'll see you on the next one.